talking
30
about
minutes of friends talk
taking
about
care of
everything that
ourselves,
matters to
taking
women.
care of our blood, what we eat,
Welcome to the
what we actually
lounge.
do, and even when it comes into sport, Dr. Fozia. So one of the things that's very important is always when it comes into a healthy lifestyle, going to the gym, practicing sport in order for you to have more of a good circulation for the blood, having all of these kind of great, of course, measurements in that kind of sense and case. So maybe like tell us more about how important is being very active in order for you to have a very good system for your body.
So, being active is a part of being healthy. And as they say, activity is medicine. And in females, especially when it comes to, let's talk about the menopausal, premenopausal
Yes.
woman, you tend to lose muscle mass starting the age of 40. Some girls start early 30s, but definitely every woman by the age of 40, she's going to start losing muscle mass. And it doubles as you age. And definitely when you're in 50s and 60s, that was going to cause you to move from a very mobile person to a woman in a wheelchair. And especially if you have chronic illnesses that will block your veins, like diabetes, hypertension, atherosclerosis from high cholesterol. So if you're anemic on top of all of this, anemia will definitely make every single chronic disease worse. Let's say if you're diabetic and you have anemia, your diabetes control will be very bad, and part of treating your diabetes is to control your anemia. And if you have heart disease and you're anemic, your heart disease will get worse. So any disease that you have, just like when we talked in the previous episode and we said about the depression, it's going to get 10 times worse if you have anemia. And females will tend to keep themselves healthy by being active. Active is excellent. But if you're athletic, like a professional athlete, let's say you're a runner, a horseback rider, any kind, tricyclic or whatever they call these new
Terms.
professional athletes, even the paddle or tennis, any kind of professional athlete is going to put the woman at risk of anemia. So whether you're a teenage or whether you're a young lady or an old lady and you're trying to be athletic, a professional athlete, even weightlifting, which is an excellent way of maintaining your health and young life, you're at risk of anemia because definitely having more muscles will need more blood flow, and you're going to use your iron stores to build these muscles. So a lot of girls, when they go to, let's say, the gym to lose weight, and they face that they're not losing any weight, the first thing to think of, are we anemic? If we're not anemic, then we move to the second question: are we iron deficient? If you're iron deficient, you can't really lose 1 pound of fat.
Wow.
Because your body will try to keep everything together and not shut down, but maintain you alive. It's like the flight and fight.
You're giving me a reason why I'm not losing weight. I have to go and check. Oh my God.
So if you're trying your best on diet, exercise, and you're not losing weight, one of the reasons probably your body is deficient in many vitamins, mainly the iron, and that will prevent your body from burning fat. So stubborn fat is basically equals plus or minus anemia, vitamin D deficiency, and other vitamins, B12 or folic acid. Now, going to the athletic woman, especially the professional athletic woman, is at high risk of having anemia because why? The demand and supply, as simple as this. They need more iron. And women, by nature, a lot of them, not every woman, they don't eat meat. And when we talk about red meat, this is your bank of iron. So there's two kinds of iron. The VIB iron, I call it, which is the heme iron, which is available in the meat, and the non-VIB iron, which is available in other sources of food, especially plant-based food. People talk about beetroot, dry fruits, kale, all of that, spinach, Popeye the Sailor Man. And, it's kind of a myth because our bodies are not ready to absorb these kinds of iron from these kinds of food, except with vitamin C. And if you add vitamin C, you need to consume a big amount of these green leafy vegetables to get a small, like it equals to a small piece of meat. Now, speaking about vegetables, they're very healthy and very good source of other vitamins, but we're only talking about iron. So every female needs a portion that is equal to the palm of the hand once or twice a week if she's at risk. So she's menstruating, she's lactating, she's pregnant, or she's an athlete. And every athletic female should be checked at least twice or 3 times a year to make sure they maintain their level. If you're an athlete and you're not checking your blood, definitely your level will go down, because definitely you will need to pump up your iron by good nutrition. We rely on dietitians to help us to educate our athletes, and all the athletes team should have their own plan to maintain the girls on track and to prevent anemia.
Indeed, doctor, and as you've mentioned here, like many activities that we as humans and females especially, we go through, especially like, exercising or getting pregnant or practicing your, one of your hobbies. So how can a female definitely enjoy living her lifestyle and at the same avoiding being at risk of, the things you have mentioned previously?
So definitely by maintaining good diet that is full of iron, we need it. We're we're consuming less iron than males, but we're losing a lot. Whether menstruating, pregnancy, as I said, and then you add to it a professional athlete. So you need to maintain your iron by your diet. That's the number one. Number two, if you're taking good, healthy diet that's full of iron, but your iron levels are always low, then you have a problem in either absorbing this iron, or you have a problem of losing that iron somewhere. Go into the physician, will figure out whether you're not absorbing, because let's say you have an absorbing problem, like people with celiac disease. These people cannot tolerate gluten in a lot of products, which by chronic consumption of gluten, they're going to develop problems, and they cannot absorb iron anymore and other vitamins. People who have H. pylori, which is a bacteria, very common bacteria, about 80% of population has it, will have less absorption of vitamins. One of them is iron. Girls who have done bariatric surgeries, even now they're healthy and they want to maintain healthy lifestyle because they lost all the fat. And I'm all with bariatric surgery. I don't think it was a bad decision, or even the let's say the LGP ones, or the injectables, like common genetic name, common trade names like Mounjaro, as people know it, or Ozempic. These hormone-like peptides can promote a good lifestyle, but you need to maintain your diet habits. You need to eat a lot of fibers and a lot of iron source, and you need to make sure that you're not iron deficient. So, because even if you did bariatric surgery or you were on these medication and you're anemic, you're not going to lose 1 pound. So it will slow down, then you get depressed, and then you stop this medication, or you regret that you've done this surgery. But definitely you've saved yourself from one of the major diseases nowadays, and which is obesity. And if you've done all of this, then definitely you have to check your blood first to make sure that you're not anemic or deficient.
Indeed,
Yes,
indeed.
I mean, nowadays we're living under the kind of methods when it comes into sport and exercise, which is very intense. They're almost compared to athletics themselves. So we're talking about a circuit, boot camp, a lot of exercises, and
CrossFit.
even
Yes.
weightlifting, which is a normal person could actually do. And we're not going only 3 times a week, but we're going on daily basis, and leaving only, I think, if I'm not mistaken, Friday off for certain gyms. Therefore, all of us are really into the concept
High
of
intensity
high intensity
workouts,
classes and workouts, which indicates that we could actually take that kind of risk. So if I am that kind of person who's actually going to the gym and attending these intense classes, but I want to make sure that my blood is actually in the right level and the right, let's say, set as well. So how many times should I always keep a check when it comes into my blood not wanting to be anemic? Like, is there a certain time for a
For
person to?
menstruating females, let's say from the age of 12 to 50, you should be checked twice a year minimum.
Twice a year?
Yes, versus males, I'll check them once a year.
Okay.
Except if that male is an athletic or he has done bariatric surgeries or have some sort of iron absorption problem. So twice a year is good for any female. And if you're not maintaining your iron twice a year, then 3 times a year. But usually twice a year would be minimum.
Good.
And a lot of female think if you're athletic and you're doing exercise, you're healthy,
Right.
then nothing will affect you. You're not going to be sick. And that's not true. A lot of athletes even get what is called DVT, which is basically deep vein thrombosis.
Okay, so we're going to talk about that in details, but
Yes.
how about we take this quick break and then we'll be back.
Sure.
So we talked earlier about DVT. So doctor, if you can tell us, when or how does DVT usually happens, and if it does so, how can one prevent it actually?
So DVT is actually not uncommon, and it can happen to any person, whether you're young, healthy, athletic, old, have just had surgery, had some sort of an illness like a bad flu, like this, just the common flu, the COVID-19 flus and the swine flus, these bad flus. Anybody can be at risk of DVT, whether you're a male or a female, but definitely females, pregnant females are more at risk again. When it comes to DVT, why is it can be fatal if that clots move from your limb, like your leg or your shaft, and goes into your lung. It will obstruct your lung and definitely affect your heart function and leads to death. It's fatal in a lot of cases, but if it's preventable, that's most important. And it's treatable if it was just located or maintained within the limb.
Okay, so does it actually happen even for women after pregnancy? Because I do remember after having, since my birth is actually by cesarean, therefore they always tend to give you some injection in order for you to prevent such things. Like, tell us more about that. Like, because a lot of women would, let's say, they're scared of needles, scared of taking injections. Therefore, they will keep it aside and say, I have nothing to do with it. I don't need it.
So 1/5 of female can develop DVT during pregnancy, and up to 6 weeks post-delivery, especially if it's cesarean section. It can last to 3 months post-delivery. And the risk factors, just having a delivery, whether it's normal vaginal delivery or cesarean is 3 times more. Is a risk factor, even if you don't have any genetic predisposition. And because of a lot of cytokines and things that happen in your body when you're pregnant and during delivery, all these anti-inflammatory cytokines get released in your body, makes all the thrombosis particles get together. It's caused like a storm in your body, and then you're at risk of developing an DVT or deep vein thrombosis. And a lot of females will have sudden death post-delivery in our grandmother's time. If you ask about an aunt or a grandmother that died post-delivery, they will say, well, she had fever, and they call it the delivery fever. There's nothing, it's just DVT. But because of that, as medicine progressed, we learned that it happens definitely. All females at risk in the first 40 days post-delivery. If you have cesarean, you're at higher risk So not all the females will get anticoagulants, but the cesarean section females will all get anticoagulant until they're fully mobile. Being fully mobile will definitely protect you from DVT post-delivery. But the problem is when you have cesarean section and all of that pain and that wound, a lot of females will not accept to move, and they would be tending to just be in bed most of the time.
Right.
Number two, the cultural aspects. In our culture, you have to sit down on, like lie down on the bed for 40 days, do not move, and all the guests will come to you and you're in that bed. We have this thing versus if you go to the Western world, they deliver today and tomorrow she's running in the gym or in the...
Even if it's C-section.
Exactly, yeah. No, C-section, they will rest for a few days. But
what I
meant,
say.
And then number three, a lot of, in our culture and many cultures, they tend to overfeed the lady post-delivery with a lot of carbs. It's good to eat a lot of protein, but not a lot of carbs. And a lot of fat, a lot of carbs post-delivery will also promote, has been related to DVT. And we call it this one of the silent killers. So the hypertension is a silent killer, and DVT, the silent killer for females. What will happen, the female will have just what they call a Charlie horse, which is a pain at the back of the leg, and she will just limp for a few hours, and she will tell her partner or her mother, please massage my feet, I have some pain here. And with massaging, they're gonna move the clot up and migrate it up to the lung and most of these females will die in their beds. Unfortunately, that's the usual scenario. She will seek medical advice, sometimes asking because for some painkillers for that pain. And that what led the American Society of Thrombosis to promote worldwide campaign every year against DVT, especially in females post-delivery. Any female that gets pain in her legs, pain in her arms, pain anywhere in the body that's a new pain that's not related to delivery, or she has syncope, she lost her conscious for a few minutes, or have shortness of breath, sometimes difficulty breathing. That's a late sign of PE, which is the second phase of DVT. DVT is deep vein thrombosis, so only the veins, and then once it reaches the lung, it becomes pulmonary embolism, and that's fatal. So having the, how can you protect yourself post-delivery? Early mobilization. I don't care if you had cesarean section, get up, move, and walk. Number two, maintaining good hydration. Always maintain good hydration, drinking a lot of water. Some cultures, even our culture, they prevent the lady from drinking water post-delivery, which is not right. And it can put you more at high risk. Number three, eat a sensible diet, healthy diet, not a lot of carbs, not a lot of fat. And if you see any signs, and we should, from this program onwards and in your community, you should promote. And I always, every single year, I maintain campaigns for as much as I can do for DVT postpartum, post-delivery. Because if you're aware and I'm aware, and we had one of these symptoms in our relatives or ourselves, then I'm going to ask my healthcare provider when I arrive to the emergency department to check me for DVT. Even if there's like tons of people in the emergency, a lot of them, when it comes to emergency department in every single, all the countries, every single hospitals, they put the high risk for the, let's say, heart attacks. But the woman who is limping and asking for help because she just delivered a baby and she's short of breath is also at risk of death at any moment. And we've seen this. Not only in Kuwait, even during my training in Canada, I still remember one lady who came to the emergency because of limping, and the emergency physician he didn't put her on priority. She was in the waiting room for 9 hours, and then she collapsed there in the waiting room, and that's it. We couldn't save her. So unfortunately, it's a life saving. Just to educate you guys, educate other ladies watching this program about DVT. and risk of DVT. Taking OCPs, oral contraceptives, can put any female at risk of DVT. And we cannot predict. OCPs can be, in other countries, can be sold in some drugstores. It doesn't need prescription, nothing. It's over the counter. But they can put you at risk of having DVT. So it's fine to start an OCP, but if you notice that one of your legs is hurting, one of your legs is growing in size versus the other leg, you have to stop, seek medical advice. So yeah, this is the thing. And DVT is not only related to females; it can happen to males also, but it's in a less, percentage.
Yeah.
Indeed, doctor. I know we have so much things also to talk about, but after this break. I know, doctor, you mentioned earlier about oral contraceptives, and it can actually be a cause of DVT. So can you elaborate more on this?
So yeah, definitely. 1/5 of female can carry a gene which may make them more predisposed to having blood clots or forming blood clots. And whether it's oral contraceptives or pregnancy itself, it's the reason that they develop these blood clots, and because of the hormones. So the oral contraceptives gives you the same hormones that when you're pregnant, and that's the reason they prevent you from getting pregnant. So if you have a genetic predisposition, you're at risk. Oral contraceptives have been in the market for like ages, right? And they've been considered safe. But in these particular cases, and when does it happen? In the first 3 months of using the oral contraceptive. So if you pass that phase and you don't have a clot, then you're safe. So not every female who takes OCP, and we cannot say OCPs are not safe. They've been used, they've been tested, and a lot of females use them. But we cannot predict who that females who carries, except if your mother had the problem or your sister, then we would definitely check you for genetic, there's like 5 or 6 genetic testing that we can do, and then tell you you cannot take oral contraceptives and give you other options like intrauterine devices, IUCDs, whether hormonal. You can also use hormonal IUCDs, but definitely oral contraceptives, not to get me wrong, they're safe, but they could put you at risk of DVT if you have genetic predisposition.
Yes.
And it's usually in the first few months. Some girls, the first few days.
Wow.
She will start the OCP today, and after 3 days, she has the DVT.
So noticing side effects, and as you've mentioned at the beginning of mostly the first 3 months of taking the oral contraceptives, you can actually observe yourself if you have any of these side effects.
Definitely.
Am I correct?
So what do you see, what you're looking for?
Yes.
Swelling in one of the legs versus the other. It's usually not both.
Okay.
It's one of them. Sometimes swelling in unusual sites, so the hand, but it's usually the legs. Pain, muscle cramps, we call it Charlie horse, as I said. So you can't really walk, you're limping, and you think, oh, I just had muscle cramps, and it's not. I'll take some magnesium, I'll rest, I'll do some massage. Don't do it. If you're on OCPs, or you're just delivered, or you're pregnant, and you have swelling, some fluid in that leg, definitely seek medical advice. If you slept on it for a few days, and you start coming short of breath, coughing, the last thing would be coughing blood. It's like a really advanced stage, and we've moved to pulmonary embolism or the lung emboli. So another risk of having clots is fractures. Even minor fractures can put you at risk of having blood clot. Traveling for long distance. And when I say this, it's definitely you have some sort of a genetic problem. And to be honest, we can only check for one 1 in 100 genetic mutations.
Yeah.
We haven't reached to testing everybody or all kind of genetic mutations, but we know the most common genetic mutation and we can test for them. And some people would probably hear this and say, okay, I'll go myself check. That's not the way to do it. You go through the normal phases, you go through pregnancy, and if you have a problem, and for some reason, the first DVT is usually very mild and it will not affect your life. The second one definitely will cause death. So usually the first one will pass smoothly, be checked, be diagnosed, and be treated. And the second one can be prevented. And then once you're checked for a genetic mutation, all the girls in your family should be checked. The first relatives of first degree, so your sisters, your daughters will be checked, and they can be saved from going through what you've been through.
Yeah,
Indeed.
I mean, and after all of what we just heard, they will just tell you you're just seeking attention. They don't wanted anything. So bear in mind that we have to always be aware and be educated when it comes into all of the things that we've heard. And it's very important to maintain your own health. We're not saying that you have to go and run and seek help once you hear about a symptom, because once we start listening and hearing about all of these symptoms, we say, like, I have them.
But
This
there's
is
no
something.
harm in
Yes.
being checked.
Of
Yes,
course.
yes, indeed.
As we told you at the beginning of the episode about the athlete females, a lot of athlete females will have DVT because they had microfracture they didn't take care of.
Right.
And then when they have the DVT, they will not seek medical advice. They think, oh, I have a swelling here, maybe it's just fluid.
Right.
And fluid comes on top. Sometimes it's cellulitis. The leg will look red and inflamed, and a mosquito bite me, and it's not. It's a DVT.
Yeah.
So if you have a concern, it's better to be safe than sorry. Just
Right.
go, be checked, no harm is done, and you're done.
Right,
And by
indeed.
simple blood test and simple ultrasound, we can tell you 100% if you have DVT, and it will only take, if you're going to be checked for that, it will only take a few hours and you're done, you're safe, saving your life and the life of
others,
ones you love.
definitely.
Yes, indeed. I mean, this is one of the challenges that we face, especially when it comes to spreading awareness, that we don't listen and we don't really bother to actually even check unless there is someone who's associated with the case. For instance, if we're talking about cancer awareness, we're never going to notice that kind of awareness until we hear a friend or someone really related is actually associated with the case. Therefore, we'll be, let's say, noticing more about it. So when we're talking more about such awareness about DVT, or even when you're talking about anemia or talking about all of these things that we've been discussing all the episode, we live in a society that's very important even for a person to spread this awareness.
Yes.
If you're not faced with the case, or for instance, I don't have DVT, like I've never had this incident before, and I'm trying to educate people about it, people will always say, but you've never been through it, therefore you're just, let's say, maybe grabbing the attention of an audience, especially that we're living in a platform where people would now seek any kind of, let's say, attention for any viewers or followers. So with that being said, how important is, or let's say, spreading this awareness in a way to grab the attention of people that it's not something to be famous about, but something to actually be more aware of?
Definitely, I would use any platform that I can put my hand on. If I went to any gathering, any female gathering, I would still spread the word about these major topics, because being a female, you're at risk of these,
Right.
and you can save someone's life. And I've been devastated by stories that I've seen. That woman in the waiting room for 9 hours still hangs on my brain. I'm not the one to be blamed, but I was like, if somebody would ever listen to her and put her as a priority, we would never lost her in the waiting room, waiting to be checked at the bottom of the list because she's a female seeking. If somebody was just asked the simple questions. So as a person, as a female, we should protect ourselves. Seeking medical advice will just take, we go to spas and spend hours and hours, and we don't care because we have fun. Going to the clinic is not a fun time, neither pleasant, but you have to go if you think that you or a loved one is at risk. And having said that, if you have kids, then honestly, I always tell my patients, when you have a child, you're not responsible for yourself, you're responsible for that child.
Right.
So as they say in the airplane, save yourself and then save your child.
Indeed.
So it's the same thing.
Right.
You should save yourself. If you're anemic, you cannot tolerate the kids' noise. You cannot attenuate what they're doing. You cannot give attention to your family. You cannot go to work and perform as before. You look at the mirror and you think, I'm not myself. There's something wrong with me. I cannot tolerate noise. I want to run away from all of this. Then definitely you have a problem, whether it's depression by itself or depression related to medical problem, mainly anemia or other problems. You have to seek medical advice. And once you're checked, this is the first. If you just know that there is a problem and it can be fixed, this is the first step to help yourself. And if you help yourself, believe me, you're going to help every person that you know, because you're the daughter of someone who needs you. You're the wife, you're the mother. And if you're not strong enough to support the whole family, then the whole family will just fall apart.
Yes, indeed, indeed. Well, thank you so much for your time. I mean, today, me and Atyab, and I'm very sure even the viewers are more educated, more aware, and more conscious about all of the things that are happening. And we really should take care of ourselves and keep it always in the top of priority.
Indeed,
Thank you very
indeed,
much.
Doctor. Thank you so much for being here with us today. And we are
My
very
pleasure.
honored, actually, to have you with us here. Thank you.
My pleasure. I'm so happy when I spread awareness, and I've been volunteering to do this many times over the last 25 years of my career. And honestly, I'm so happy when it comes to education, educating one person. And we're now using this program to educate maybe hundreds or thousands, whoever is watching us.
Indeed. Thank you.